Hello and welcome to True Pathfinder, your portal to health and truth. We get contacted a lot by chronic pain sufferers, whether it is chronic back pain, neck pain, pelvic pain, headaches, migraines, and those people are truly desperate because they have tried everything in the book: surgeries, pain medications, pain management clinics, psychological treatments, and nothing has helped. And as we will see in the course of this presentation, unfortunately, that is rather the rule than the exception. Why is that the case? Why can those mainstream treatments not resolve those people's chronic pain situation? And how can we heal chronic pain without any medications or surgeries in a scientifically proven way? Well, let's find out. The sad news is that chronic pain has become extremely common. We have a true epidemic of chronic pain. It affects more than 30% of the population in the US alone. Think about it. That means that over 116 million people in the US alone suffer from chronic untreatable pain. More people suffer from chronic pain than from diabetes, heart disease, and cancer combined. And those statistics, scary statistics really, come from the CDC. So those are the official numbers. Hundreds and hundreds of millions around the world suffer daily from headaches, stomach pain, back pain, pelvic pain, or even widespread pain that is known as fibromyalgia. And the worst part is that studies have shown over and over again that despite trying many things, most cannot resolve their pain. The most common treatment methods are completely ineffective. No study has proven that surgical interventions like back surgeries help. Same goes for back injections versus placebos. Same goes for opiates, psychological therapies like cognitive behavioral therapy, acceptance and commitment therapy, and relaxation therapy. All have been proven to have little to no effect in many studies. Why? Well, in order to answer this question, we must understand where the pain comes from. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below for you, as always. Also, do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. For the holistic care you need and deserve, do not hesitate to contact us at christine.doctor, and we will take care of you holistically, remotely, and naturally. Also, of course, when it comes to chronic pain. And take advantage of our sales action that is still ongoing at vibrantbody.net until the end of the year, and get some of the most powerful holistic health tools available on the market today at considerable discounts and with free worldwide shipping. Links, as always, also in the description box below. So, most people, and even doctors, still believe that the main cause of pain is physical. As we will see in the course of this presentation, this is completely untrue. The pain, just like all of our experiences, is created in the brain. Take vision, for example. Have you ever had a situation that you are looking at something, like a pen on your table, and you don't see it? We all have had this experience. Why? Because the picture is created in your brain. Only 10% of the nerve fibers that go to your visual cortex, which is the vision center in your brain, come from your eyes. The overwhelming majority, namely 90%, come from other brain areas. And this means that you can see different things depending on how you look at it. More precisely on how your brain interprets the signals and what kind of image it creates. Just look at the picture here at the bottom right. What do you see? A rabbit or a duck? Or both? If you look on the left side of the picture, you see the beak of the duck and then the eye, of course. And if you look at the right side of the picture, you see the head of a bunny. It all depends on how you look at it and what kind of picture your brain creates out of these signals. The same goes for your pain. Your body does not send pain signals to your brain. It sends signals, and then the brain interprets those signals. And depending on whether it perceives the situation as a dangerous one or not, it can either activate the pain sensation or not. So the brain has to activate the pain sensation in order for you to feel it. All pain is truly in the brain. And that is why people who have lost a limb still feel pain where the limb used to be, despite the limb not being there anymore. That is known as phantom pain. Still don't believe me? Let's do another little experiment. Look at the pictures on the right. Let's start with the one at the top right. That's a picture of a construction worker who has put a nail with a nail gun through 3 of his fingers. I can feel the pain already and I don't have a nail through my fingers. Do you know what the astonishing part about this picture is? That this construction worker didn't feel any pain at all. Then we have the case here at the bottom right. Another builder, age 29, he came to the accident and emergency department having jumped down on a 50 centimeter tall nail that, as you can see, went completely through his work boot and supposedly through his foot, right? The smallest movement with this patient was painful and he had to be sedated with fentanyl and midazolam because otherwise they could not extract the nail from his foot and take the boot off to treat him. So they sedated him and they took the nail out, and then when the boot was removed, a miraculous cure appeared to have taken place because despite the nail entering the boot, it had miraculously missed the foot completely. It went between his toes. Still, despite no tissue damage, the patient experienced extreme pain. And this case was reported on in the British Medical Journal in 1995. Those two cases show you clearly, I think, that the pain is truly created in your brain. Additionally, an emotional injury can also and does activate the same parts of the brain as a physical one. This has been proven again in many studies. You see some pictures here at the bottom left from a study and with the brain areas that are activated, and they've proven beyond any possible doubt that emotional injury activates the same parts as the physical injury, and that's how emotional injuries can also cause physical pain in us. Additionally, children who grow up feeling unsafe and rejected due to parental abuse, parental neglect, etc., etc., also sensitize the danger alarm mechanism in the brain, as studies have shown. And this mechanism can be later in life when the child is not in an unsafe situation anymore because it's not living with their parents anymore, still can this mechanism can be reactivated by other stressful events in that person's life or physical incidents like a car accident. When you scan the brain of people with chronic back pain, somatosensory areas of the brain go down to normal, but emotional-laden areas flare up. What does this mean? This means that chronic pain is not a physical problem for most people. There is a whole range of pain conditions that are connected to each other. You can see them here in the graph at the bottom left. And the chance that your chronic headache or migraine or back pain stems from a physical problem is minute. It's about 2 to 3% only. Studies have shown that 85% and more of people with neck and back pain do not have a clearly identifiable physical or structural cause. To prove this point even further, here's another study from 2015 by Brinjicki and colleagues, and it delivers some interesting insights and proofs. They found out that when they took completely healthy, pain-free 30-year-olds and performed MRIs on them, a whopping 50% had disc degeneration, 40% had bulging discs, 31% disc protrusions, 20% annular fissure, etc., etc. When they looked at 50-year-olds, 80% had disc degeneration, 60% disc bulge, etc., etc., as you can see also from the table here on the right. In still older patients over the age of 70, over 90% had structural spine problems, but no pain, meaning the overwhelming majority of these patients had a physical problem, but still no pain. On top of that, it has been proven that pain can be contagious. This is known as social contagion. In an interesting study from 1991, they looked at back pain in the East German and West German populations. And the Eastern Germans had much less back pain than the Western Germans. Those numbers went up as the years went on and reached the same higher levels of the Western German population as the two populations mixed after the fall of the Berlin Wall. Apparently, back pain can be a contagious disorder. Especially for job-related repetitive strain injuries, social contagion has been found to play a major role. For example, if at your workplace, let's say you're working as a nurse, your colleagues are all complaining about back pain, chronic back pain, your chances of having chronic back pain as well increase significantly. We have to answer also another very important question. Why do chronic pain sufferers mostly get worse and not better over time despite the treatments they undergo? And why does the pain tend to spread? Well, that is because a vicious cycle is created. You are afraid that a pain sensation hints to a structural problem in your body. The brain activates the danger alarm mechanism and becomes more focused on the pain. And as a result, you have more pain. You get anxious to experience more pain in the future, and doing so, you create a neural pathway in your brain. So the pain becomes learned. This cycle is then reinforced by your problems finding a solution. So the doctor tries to fix your pain with no success, and this leads to no hope, and as a result, to even more pain. And the tricky part is that this all takes place at a subconscious level. Therefore, you are not aware of the vicious cycle you are creating. How can we heal chronic pain successfully then? Well, it all starts with a proper diagnosis. When we evaluate chronic pain patients, we must answer the following questions. Is the pain caused by a physical or structural condition? That is only the case in a minority. Or is it caused by a neural pathway in the brain that has been created by stress, anxiety, emotional conflicts, etc., etc.? As mentioned, the emotional injuries or the psycho-emotional problems activate a pain sensation just like physical ones. Pain is just a signal, a message. We have to encode it. We have to find the cause of it. Is it stress? Is it fatigue? Insomnia? Depression? A biological conflict? Once we have ruled out a physical cause, we can then focus on the psychosomatic part and its cause that we need to address. And in order to find the cause of the psychosomatic part, we have to work with the patient and ask some questions to find the red flags. For example, did the patient experience adverse childhood events? Does the patient have a tendency to please people, to be a perfectionist, to care about what other people think about him or her, to be overly conscientious and responsible? Now, don't get me wrong, these are not bad traits, but those people tend to put more pressure on themselves and have therefore a higher tendency to activate the danger-fear mechanism in their brain. We also have to ask, does the patient experience a variety of pain symptoms over time? For example, first headaches, then stomach pain, then insomnia, then back pain, etc., etc. Also, does the pain spread? Where did it start? Does it shift from side to side, as is often the case with fibromyalgia? When did the pain start? What was going on in the patient's life at that point? And this also includes looking into social contagion, of course. So, did the patient change job or country at the time when the chronic pain started? At which time of the day does the pain start? Under which circumstances does it start? Does it go away when you are on vacation, for example? Does it start when you are under a lot of stress and pressure at work or at home? All of these questions and many more have to be asked, and that is what we do when we have a chronic pain patient here at christine.doctor, link in the description box below, of course, and only then can we work on the solutions. And speaking of solutions, let's look at some of them. Again, all of those solutions do not involve any type of surgery or medical treatment. The first one that I want to show you that has shown a lot of promise is from a random control trial with 230 patients who were suffering from fibromyalgia with severe pain but had no physical cause. These patients were divided into 3 groups of treatment. One group, the placebo or control group, received only education about fibromyalgia, nothing else. Then in the second group, they applied standard pain psycho-behavioral therapy. And in the third group, they treated the patients with what the researchers titled emotional awareness and expression therapy. The assessments were baseline, post-treatment, and a 6-month follow-up. And the results were truly astonishing. In the emotional awareness and expression group, they talked to people about the connection between the emotions and pain that we have discussed and asked them to look and express these emotions that they might have avoided their whole lives, such as anger, guilt, sadness, compassion, etc. Symptoms, stress, life reviews were asked from the patients as well. Experiential expressions or exercises of guilt, anger, sadness, developing compassion and forgiveness, learning to honestly confront troubled relationships. All of this was asked from the patients. Not an easy task, as you can imagine, but the result was that after 6 months, the emotional awareness group, who went through all of this trouble, had 50% more pain reduction than the other groups. The number of people still meeting the criteria for fibromyalgia by the end of the study was also significantly reduced. And that means that this type of intervention was far superior to traditional psychological intervention. And you can see the graphs of the results here below. What does all of this tell us? It tells us that a true paradigm shift is needed when it comes to our understanding of chronic pain and how we treat it. Lots of people with chronic pain and other chronic diseases for that matter have issues in their lives. Pain and diseases are connected to emotions. That is why we also speak all the time about the biological conflicts, the psycho-emotional part of chronic diseases in our presentations on the many conditions that we discuss on this channel. Don't get me wrong, the pain is real, but the majority of the chronic pain sufferers do not experience the pain because of structural or physical problems. The pain is instead caused by neural pathways that have been learned and can be therefore unlearned. Patients can have hope, therefore, to become completely pain-free again. With this insight, you will be able to start telling yourself that you do have indeed hope, that you can recover. And as a result, you will start telling yourself, I can walk pain-free, I am not damaged, I am not a cripple, I am not dominated by my pain anymore. We can change the brain pathways that we have created as we start to think and act differently, and this enables us to soothe our danger mechanism in the brain that creates the pain. And to achieve that, we have at our disposal many techniques. I've showed you one already, the emotional expression therapy. We can also access our emotions on a regular basis, search for the emotions when the pain arises. We can use what is known as expressive writing. You can, for example, write a letter to your brain telling it you can do it, you can face this situation and you can resolve this. Mindfulness meditation can help. It has been shown to have small effects, but is still very useful when you pair it with the conviction of the source of the pain, and it's also critical for dealing with negative thoughts. And then, of course, changes in your life might be necessary. Less stress, accepting unalterable situations, setting boundaries, leaving a job, a partner, etc., etc. Don't think that this will resolve your chronic pain situation immediately, though. It will take time and you will experience ups and downs. Therefore, you must persist. Time for conclusions then. What have we learned? Well, Pain is necessary. It is a protective mechanism that acts, as we have seen, via the neural pathways. Stress and emotions activate the danger alarm mechanism in your brain, and they start a vicious cycle of pain, fear, and more pain. The biggest portion of pain is indeed brain-induced, as proven by MRI images showing it is not related to physical problems in most cases. That's why most patients don't need surgeries, painkillers, pain management clinic visits, etc., etc. We can treat chronic pain successfully. The good part about this situation is that we can clearly diagnose the causes and distinguish clearly between the physical and the psychosomatic. Living pain-free, again, is possible with the right therapies such as educational, cognitive, behavioral, and affective interventions. These insights into pain hopefully explain why we here at Christine.Doctor always look holistically at chronic health conditions and also always emphasize the often overlooked psycho-emotional side of things in our videos. Do not hesitate to contact us at Christine.Doctor, link in the description box below, and we will take care of your chronic conditions holistically and naturally. Also, do not forget that until the end of the year, we still have our sale at vibrantbody.net going on, where you can save hundreds of dollars on 4 amazing holistic health devices. We also ship them to you for free anywhere in the world. Stock is limited, so be quick. Link to our sales action is also provided in the description box below for you. With all that being said, I hope that you've enjoyed this presentation. If you did so, please consider supporting us directly by becoming a patron from as little as $5 per month. Link in the description box below, of course. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. Thank you very much for your attention, and until next time, stay healthy.